Hi, everybody. Welcome to another edition of On Oshkosh. I'm your host, Cheryl Hentz. Very pleased to welcome back some folks who have been here in the past, and I think maybe one of them hasn't been here in the past. I don't know, but we're very happy to welcome three ladies from the Winnebago County Health Department, and we're going to be talking tonight about aging and, some other stuff, not just necessarily all about aging, but wellness in general, but there is a large segment of it that's devoted to aging and how to keep safe and healthy as we age. So even if you're not of that age group, maybe your parents are, or you want to just stay tuned and be interested in it, because at some point it will affect you. So, and sooner than you think sometimes. So anyway, welcome to the show. We've got Joanne Murphy-Spice to my right. To her right is Nicole Davis.
No, that's Lindsay.
Oh, that's right. We switched. Lindsay, is it Euchre?
Yes.
Okay. And then we have Nicole Davis Daywald?
Yes.
All right, excellent. So, welcome to the show, all of you. It's a real pleasure. So, I guess the first thing we're going to do, Joanne, is you're going to kind of talk about the year in review. Is that correct?
I think so.
All right. Have at it.
Oh, I thought you were going to ask me a bunch of questions. First of all, I just want to state to everybody that's out there watching, you will age, because there's only one alternative to it. And my first thought when I aged was, who signed me up for this? This is hard work, aging. And how do you do it fun? Make it more fun and just more livable. And it is not for the faint of heart, aging isn't. And so what we do with our Wellness Plus classes is we offer highest level evidence-based, which is just a big giant word that says it's been researched and tested, classes for people. They're geared for people, I would say 62, 60 and older, but anybody can really be in the class that has that need. Mm-hmm. So like Healthy Living with Diabetes, well, you can be a diabetic at 18, so you could be in the class. But most of our classes are geared towards chronic conditions as we're aging, because we tend to add more chronic conditions to our life as we age, and also falls prevention. And a lot of them are fun. And we were doing really well, and then COVID came. And just like it did for everybody, you almost have to start over with everything that you're doing. Yeah. We lost leaders, people weren't interested in being in groups. So we've just been rebuilding. But every year we have gotten more and more people involved. We have recruited more leaders. We're adding classes as we see and as the people in our community in Winnebago County tell us this is what we'd like to see.
What's the average class size, Joanne?
It kind of depends. Some of them have maximums and they all have minimums. If you're doing like a workshop where you're really getting into deep talking about chronic conditions and working with them, we like to sit more around 8 to 10 people. Mm-hmm. But if you're in Tai Chi or Strong Bodies, we can handle 20 people. We can handle more people. Sure. So it kind of depends on what the class is.
Mm-hmm. So you mentioned Tai Chi. So, when I think of Tai Chi, I think of, something where you've got to be somewhat nimble and, your body's got to move in certain ways. And a lot of us, as we age, our bodies don't move in those ways anymore. It's kind of like yoga, you don't think of yourself as being able to do those things just because we may have chronic conditions and we may be sore all the time. And so I'm assuming that since you offer this for people who are aging, there are ways to participate even if you don't move as if you were a 20-year-old.
Right. And I'm glad you brought up Tai Chi, because that has been the one that we are getting constant requests for more of, because there's not a lot of them around. And people are realizing that in terms of falls prevention, that's probably the best exercise you can do, because there's so much weight transference. And you're really focused on that, so your body starts to learn to really be aware of how you're transferring your weight. And so we started with an adaptive Tai Chi class, which you can do in a wheelchair or walkers, or maybe with just a chair. We won't let anybody be in class without at least something like a chair next to them in case they need to sit down or grab something. And all the exercises you do can be modified somewhat.
Okay, well that is really good to know.
And then we added Tai Chi for arthritis and falls prevention. Those moves really are focused on soft movement for arthritis, because the irony or paradox of arthritis is it hurts to move, but moving's the best thing you can do for it. So then the movements are softer and really, really focusing on that weight. We have a new one coming up right now that we just started in Neenah, and it's coming to Oshkosh this summer, I believe, and that is called Tai Chi for Beginners. And that one, we really focus on what is Tai Chi, because the added benefit we've gotten from this class, from the evals that people give out, is not only that, oh my gosh, I have such better balance. I am moving around so much better. I don't need to use my walker outside, or I just use it outside. I don't have to use it inside.
Yeah.
But I am calmer. I am not so anxious. I am because it's such a slow movement that it's called It's called moving meditation. So they're slow movements. They're very methodical. They are not hard. These movements are not difficult. Anyone can do these movements, really. I mean, this is not a hard movement, but it's taking it deeper, adding your breath. If you're standing, it's can you bend your knees a little bit more? People who are really great at Tai Chi, who have done it for 40, 50 years, they can do it almost in a bent position. Well, none of us do it like that.
Yeah.
But we still get stronger, so it's more about going into depth.
So it's currently being offered in Neenah, and it's coming to Oshkosh probably sometime this summer.
It's going to Amro in the summer. It's coming to Oshkosh. Yes, and Oshkosh Senior Center always puts on the Tai Chi for falls and arthritis every year. So there's partners everywhere, and there's classes. But that's a big one.
So the Senior Center, then, is that where you offer these classes?
Well, some of them.
Okay.
Yeah, we have partners all over the place.
Okay.
And honestly, if a church said, our parishioners would really like to, this happened to me in Neenah, actually. They had a senior group in their church, and I went and talked, and they're like, we'd like to have a class. And so we did 2 classes in their church. And then the people if you have enough people, we'll hold the church anywhere we can hold, or, we'll hold it anywhere we can hold it.
Sure.
We hold classes at independent living facilities.
Okay.
If you've got room, we'll hold a class.
Sure. All right. What other kinds of classes do you offer for
we have
the general public, I guess, especially the people who are aging?
We have Stepping On. Stepping On is a 7 weeks falls prevention class. That's more of a classroom class. I mean, it's a lot of engagement. It's a lot of interaction, and you do some exercise, but it's not strictly an exercise class. And that has guest speakers, like a pharmacist. John Holland will come in.
Oh, from the fire department?
Yeah. You'll have someone from the Office of the Vision and the Blind. A physical therapist works 3 of those days with you, and you work on the whole gamut of falls, not just the exercise and balance part. But you do that as well, strength and balance. But then it's a whole myriad of other ways. I mean, you take tours of your house and figure out where those, do we really want 10 dogs? Maybe we shouldn't. I don't know. And then that's a big one, the Stepping On Falls one. The other falls one that we do also is really good for osteoporosis, and that is Strong Bodies. And that is a strength training class with balance and flexibility. It started out for women, but now it's for everyone. And that is, I'm going to put a personal plug out there for everybody. Walking is great. Biking is great. All those things that get that heart going are fantastic. But as you age, you have got to get stronger, because that's what makes you frail. You don't have the muscle mass because you lose that as you age.
Yeah.
And so a lot of the moves will mimic what you got to do, like reaching up. The grab bars are good, but you got to be strong enough to use the grab bar.
And you talked about bicycling, and I was just talking with my family and some friends about this in the last week or so. I've got a really nice bike sitting in the garage, but I'm a little afraid at my age to take it out because I don't want to fall. You can wear your helmet, and that's great, but unless you're going to put on a suit of armor, the rest of your body's not protected. And so I was thinking in terms of, okay, gosh, is there such a thing as putting training wheels on a?
There's three-wheel bikes, you know.
Yeah, that's what I ended up thinking about.
I see the three-wheel motorcyclists out there too.
Yeah.
Yeah, but taking a Tai Chi or taking a strength training class is going to make your balance better for riding the bike and get that confidence back in there. Because you'll get on it and you'll be like, yep, pedaling it's just like riding a bike, you know?
Yeah. How long are the classes?
Yeah, that varies as well. Like stepping on is 7 weeks, and it just meets once a week. But Strong Bodies is twice a week because you've got to do the strength training.
Yeah.
Tai Chi is once or twice a week. Kind of depends a lot on availability of the leader, the building, that kind of stuff. That one goes for 12 weeks. It varies. We have a class called Mind Over Matter. We call it MOM. It's just for women. But it's a bladder and bowel incontinence class. They only meet 3 times. Okay. And then there's breaks in between there where they work on some exercises.
Are there charges for these classes?
There's not a charge. There's a suggested donation.
Okay.
And that's just to cover like the stuff we're printing, or like some books have manuals that we have to purchase and give out, the weights, the dumbbells that we have to buy. So it's a suggested donation, but we don't turn anybody away.
Yeah.
And usually the suggested donation is like $15.
Oh, yeah, that's not bad.
Well, what we found human nature is, if it's free, it's easier to not come. If you have money in and you've got some vested interest in it, you've got some skin in the game, you tend to make it more of a priority.
Yeah, never thought of it that way, but that's true. All right, I'm just looking here at, okay, so new trainers, you need new trainers?
We kind of always need new leaders, and right now I would say the biggest need is anybody that out there that likes to do Tai Chi or is interested in Tai Chi or likes to lift weights and would like to work with seniors to get stronger and less frail, because that's our biggest demand for classes right now. And just like anything, you know, you get attrition, people change jobs or they decide they don't want to do it anymore. But I can't hold the amount of classes for those 2 that people are asking for. Yeah. I don't have enough leaders. And then for some of those other classes, what I really need is more participants. I need people to get their friends and say, yeah, we want to do this class together, because if 4 of you want it, the state's asking me why there's not a minimum of 8 in there, you know?
Yeah, yeah.
And so, you know, get your group of friends together and say, hey, will you come and do a class? And we will. Yeah.
So if people want to, you know, perhaps become a leader or a trainer, how do they get in contact with you? Do they just go to the county's website?
Yes. Just, hey, I'm interested in helping Joanne out with that. And
all right. Well, that's good. And for people listening to this on the radio, the website address that you would go to would be co.winnebago.wi.us/health. So if you're writing that down, it is co.winnebago.wi.us/health. And I'll try and remember to mention that again throughout the show. Future goals for your programming. What are you thinking about there?
Honestly, it's just to continue to grow. Like I was looking, and we've gone to like 19 different locations that we have classes in the county. It's, you know, to continue to get to those pre-COVID numbers and beyond, and like I got to do a lot of talks at churches prior to prior to COVID. Then it got much harder because we were so busy just building up the program again. Yeah. And the more we can get the word out there to everybody, I think there are people that want to take these classes. And you know, we're always in the ADRC newsletter. It's a huge marriage between us, so you know, you can always ask over there too, and they'll direct you to us. So yeah. And you know, one thing about the classes that is a fringe benefit for a lot of them that wasn't the goal of the class: taking healthy living with diabetes, taking living well with chronic pain. Taking those kinds of classes, you're taking them for a specific chronic condition. But what people got out of it was a huge social connection to other people that are in the same boat they're in. Well, and people make friends in these classes.
Yeah. Let's talk for just a moment about the social connections, because those are they're important at any age, but they're super important as we get older and our friends die.
Yeah.
You know, so let's talk for just a moment about that.
Well, and I know, Nicole, you're going to talk about that as well.
Okay, that's up for you, yeah.
So I don't know if you want to jump in or you want to wait, but...
Sure, go ahead.
Sure. So I supervise the aging programs at the ADRC, and one of our biggest focuses right now is on prevention and ensuring that people are not socially isolated, because social isolation significantly impacts all aspects of your life, right? And so one of our focuses is on holding events that get people out of their homes and can connect with other people. And so I have a couple of events that I'd love to talk about. One of them that we started last year, that we do every October, is that we do a leaf raking event. So we have people in the community that have the most need. We partner with students at the high school, and we rake their leaves for one day to provide a service to the community. Not only does that assist with getting the work done, because it is expensive and it's something that impacts people from being able to live in their homes, but it connects them with younger people. And hopefully we can grow a sense in the community of helping other people. You know, when I was a kid, the neighbors helped neighbors, and you ran around the neighborhood, and that just has changed a lot.
We don't see that kind of thing anymore.
And how do you get that back? How do you get back knowing your neighbors and trusting them watching your kids running around the neighborhood? And so to start that, we hope that having younger people see a connection with older adults. One of the other things that we've been doing the last 3 months is, and Lindsay's been helping me out with this, is we have been doing Carts, Cats, and Connections. So we have been taking older adults in the community and picking them up and taking them grocery shopping, assisting with that, providing them with a gift card. Some of these older adults haven't had fresh produce, because that's something that if you can't get out to the grocery store yourself, that's very difficult to get. And then we've been taking them to Planet Perk, to the cat cafe, to connect with other older adults and the cats and us. And it's been really awesome. They've really enjoyed it. We were doing it in the winter months because we had a grant. And in the summer, people get out more, hopefully. One of the other things that we are doing is we're doing a wheelchair wash. So on August 10th, from 10 to 12, it's something that's free for the community, is you can bring your wheelchair or your scooter out, and that can get washed. It also just provides a connection with other people and resources. We are doing an elder abuse awareness and prevention event on June 12th at the County Executives Building. And we are focusing on different forms of prevention. And one of the biggest forms of prevention for elder abuse is that social connection with other people. And so there's 3 other ways to get that social connection. So transportation, that is an issue for a lot of older adults. So if you are 60 or older, you can use Senior Dial-A-Ride. It's $4.50 each way, but you have the ability to have a cab come to your home and take you wherever you'd like to go, as long as you pre-schedule 24 hours in advance. A lot of people don't know about that. They're stuck in their homes and they don't recognize that a cab would be able to come and take you to the senior center, to one of Joanne's classes.
So how do they get in touch with this Senior Dial-A-Ride program?
Sure, just call the ADRC or go to the senior center. They can even call Go Transit, and Go Transit can help them with that.
And how much is it each way?
It's $4.50 each way.
Got it. All right.
And for rural, they also have rural. You get 10 one-way rides with rural, because it is a bit more expensive to do that. But either way, there is the opportunity to get out of your house, to connect with other people, to go to programs.
Sure.
And one of the other ones is the congregate meals. And so I think a lot of people don't recognize that Winnebago County has 11 different congregate meal sites. One of them being the Menasha Senior Center and also the Oshkosh Senior Center. It's donation-based, so it's whatever you can provide, and it's for people who are 60 and older. So you can have a meal and connect with other people, and get out of the house. You can use the senior dial-a-ride to get there if you have issues with transportation. But getting out of the house is really important.
Sure. Okay, so I don't want to steal all your thunder there.
Sure. Yeah.
Because we've got some slides that we're going to be showing,
Sure.
and we've got them set up in a certain order. But this wheelchair wash, tell us again when that is. It's August what?
Yeah, sure. It's August 10th.
August 10th.
From 10 to 12.
10 to 12. And where is it?
You know what? I don't have the flyer with me, but if you call the ADRC, we can get you all of the information.
Okay. And for folks who don't know what the ADRC is, it's Aging Disability Resource Center, correct?
Yes.
Okay. And by the way, they also put out an absolutely wonderful book. You know, it's probably about this thick. It's got everything in there that you could possibly want or need. So I would encourage folks to pick one of those up. And where can they pick those up, by the way?
Sure. So there's places all around the community that have them. But
grocery stores?
Grocery stores. If you come to the ADRC, the hospitals have them. I know Public Health has them. Okay. Advocap has some. We also offer it online. So if you go to our website, you can research it online. Okay. But you can call us, and if there's a resource that you need, we can highlight it in there and send it to you.
Perfect. All right. Excellent. Okay. So let's go back to you for a moment, Joanne.
Oh, yeah.
Anything else that you want to talk about as far as, you know, the programming, what you may see coming in the future, anything at all?
Not that I can think of off the top of my head, except I do think that these classes are evolving. We're finding some people are starting to take them virtually, and you can have that option. We don't offer it. I don't have enough leaders, but anybody in Winnebago County could take a virtual class because I can hook you up with that. Mm-hmm. You know, you can take a class in lacrosse if you're virtual. Yeah. So there's some of those that are now offered for people that are maybe very isolated or yes. whatever. We have also worked with Advocap and gotten drivers to bring people from like a home, like an independent living facility, to one of our classes. So I like to pursue that kind of stuff more, like using the transportation to get people, into those classes. I also see that we're going to start to take things like our Tai Chi and Strong Bodies, where we have a lot of people that are already involved, mm-hmm. and we're going to start piggybacking off of those, I think. Okay. Prevention things, falls prevention, chronic condition things. Yeah. Meet people where they're at. I see some of that evolving because people are busy and sometimes you just want to go to one place. You don't want to have to take two things. Yeah. And I see that kind of changing in the future. Okay. But there's a lot of stuff out there, everybody.
Okay. All right. Excellent. Well, let's talk with Lindsay now. Yes. So, Lindsay, you are, what is your title?
I'm a public health nurse.
A public health nurse.
Yes.
Okay. So you're going to be talking to us about, home visits and elderly type services, or I should say services for the elderly.
Yes.
And, when I was younger, I thought of my grandparents as elderly, and now I'm that age, but yet I don't think of myself as being elderly, yeah. And yet I am. So it's just kind of a weird thing, the way you just age and it all evolves. So talk to us about the various things that you do with respect to home visits and other things that you provide to folks in the county.
Sure. So we do offer home visits free of service, where a public health nurse would come into your home. We kind of get to know you, see kind of what is going on and how we can help you. A lot of people would call us and needing for us to do a falls assessment. Mm-hmm. So maybe they went to one of the Stepping On classes, or they saw us in the ADRC newsletter, and they're really worried about falling in their home, and they want to make sure they're safe. So they do reach out to us. A nurse would go out into their home, look around, check their stairs, lights in their home, their bathroom, different stuff in their home to make sure they're safe. And then we do also talk to them and get to know their background. So what medications they're on, see if we can help with those issues. Because a lot of times as you age, you're on medications, you don't realize that cause you to fall. So we really have those conversations to make sure they're checking in with their doctors and making sure those are safe. Or do they need help setting up their medications for a nurse to come in and kind of help with those services.
Now, so they just call the Public Health Department,
Yes.
the Winnebago County Health Department, and they say they'd like to have someone come out and do a home visit. Is there anything else that you do during this visit, and is there a charge for it?
Our services are free for us to come out. We definitely will come out and do an assessment just to kind of see what is going on. From there, we'll kind of determine what resources we can connect you with, because sometimes it's just having those conversations and you really just need to get into an exercise program or have some exercises, so we'll connect you to what that looks like. Sometimes it's getting you connected to a vision service, because maybe your vision is getting bad.
And that's bad for falls too.
Correct.
Especially at night.
Correct. So those are something we look at, like when have you been at an exam? So we really get to those different root causes, which could be related to falling, and we want to prevent you from falling before it happens. We will go in and take people's blood pressures if they do need, and kind of check that during our assessment, because sometimes blood pressures, people are too high or low, and that can contribute to falling too.
Sure. Now, do you just go out the one time, or is this kind of an ongoing
It really
thing,
depends
or?
upon the client.
Okay.
A lot of times, for sure, we'll go out the one time. Some people need us to come out more, so that's something we kind of look at as we talk to them. Some we can connect them to a service where an agency would come in and help them, or maybe they just need some education of how to do it themselves, and we teach them how to do it. So we may come out 1 or 2 times, and after that they feel like they're comfortable, have the skills to do it on their own. And others need us a little bit longer to build those skills, or have a family member come in and kind of learn those skills along with them.
Okay, all right. What else do you offer from your position?
From us, so we, like I said, we do the home visits. It can be anything from the falls or the actual going in and helping with any sort of med management. I do a lot of education related to them, and steer them towards stepping on classes if they're needed, or ADRC if they are needed. So I do more education and really just make sure they're safe and can stay in their home.
Sure. And, it is really, boy, there's some weird noise in here. I'm not sure what that is. Oh, okay. It sounded like we were getting a torrential downpour, actually. I thought, wow, that is really loud. It's so, we talk about falls, and I'm sure people are sitting there thinking, just like I did when I was younger, there's nothing to falling. You can stop yourself from falling, and it can happen so easily. Yes, pets can get in the way and kind of knock you down. I've got a dog, and when she gets really excited, she wants to, if she's headed for the door, it doesn't take much for her to bump into me as she's bolting for the door. So I'm very careful that I'm holding on to something, even just touching the wall kind of as we go. But tripping over a rug, just your body doesn't always work the way it used to, and so maybe your feet aren't being picked up as well as they used to be, and you kind of trip that way. And I know for myself, just the other day, I was at the stove, I turned halfway around this way, and I kind of lost my balance a little bit. And who knows what causes that, but there's something that causes people sometimes to fall. It can be medications like we've talked about, or it just can be, who knows.
But that's the nice thing about those exercise classes, though, because the exercises start to work on body memory, so your body can start to react better. So that you might fall, but you can catch yourself instead of going all the way down.
Yeah, fortunately I did, but I'm certain that there could be a time when I wouldn't be able to catch myself, or somebody else. And I know that the fire department is very involved in fall prevention also. Is John Holland the one who comes out and helps with that also?
They do have it, and they just started that new Nimble app too.
Yeah, let's talk about that. And I know we've got some slides that we can show here. The Nimble app, it's NY, N as in Nancy, Y, M as in Mary, B as in boy, L. So NYMBL. And it's an app for your phone. I downloaded it. It's a really cool thing talk to us about what it is, what it does. We've got a public screen up on it now that you can see from the Public Health Department. And if you can just scan the code on your phone or tablet to access that's a referral form.
Yeah, that's a
right
referral.
That's
so
a referral
that's
form.
another
Okay.
way they can access our services.
Okay.
So, besides calling.
Okay, we don't need that right now either.
Yeah, besides calling, they can also scan that code or go online to get services to have a public nurse come out. So that was what that code was.
Okay.
Yeah, but the nimble.
This talks a little bit about falls.
Yes.
And as long as they've got the screen up.
Oh, sure.
Let's talk about this.
Yeah, so just like with the exercise courses, we were doing really good and kind of getting out there, and people wanted to kind of have a nurse come in and look at their homes and how they could prevent and stay safe before a fall actually happened. COVID hit and we kind of slowed down a little bit, but since then we've been picking up our services. People are welcoming us back in their homes. They really want to prevent those falls from happening and have somebody come in. So this kind of showing how we're picking back up again.
Sure. So what's the difference between a community referral and a fall referral?
Sure. So community referral would be maybe somebody's worried about their meds, so more that med management piece, or they have a chronic condition that they're just not sure how to manage it, or what resource to be connected to as a nurse. So as a health nurse, we'll go in and kind of help make those connections for them, so they're not so worried about falling. It's other medical conditions they need assistance with. The falls are truly, they want us to go in to make sure their homes are safe and ready and they can prevent themselves from falling. This is, kind of what we would do during a falls assessment. We do go in, we look at your bathrooms, your kitchens, your bedrooms, all areas where a fall could occur. How does your inside look to get into your home? So we really do a full scan of your home and then get to know you and your medications and make recommendations of how to improve your home.
Now, this particular screen that we have right now, that's showing a grab bar in that one photo.
Yes.
As part of a falls assessment thing, if you determine that someone could use bars in the shower, just in the bathroom itself, maybe somewhere else in the house, I've heard that there is an organization out there, and I don't know if it's income-based or not, but they will come in and put some of these things in your home.
Yes.
And I don't know if there's a charge for that or not. But who is that does that?
The Building Together is an organization that we would help connect
Rebuilding.
you. Rebuilding Together.
Rebuilding Together, okay.
That is an organization that if we go into your home and see like you need different grab bars or ramps to get into your home, different modifications, we can connect you with them. You do have to apply, but we can definitely help assist you with applying to that program. They do have some income and some criteria to be eligible, but we could work through that and help you with that application.
Okay, all right. So, do we have any other slides related to fall prevention? Otherwise, we should talk about Nimble.
Oh, sure.
Okay, we've seen this one, so we can move on to the next one.
Yeah.
No, we've seen that one, so we can move on. Okay, what is this showing?
This is the Nimble app. So
Okay.
this is, the fire department really did promote and has sponsored the Nimble app. It recently just came out, and it's free to residents of Oshkosh. So anybody that lives in Oshkosh and is 60 or older can definitely get this app on their phone. It is evidence-based program. You can download this and do all the exercises right in your own home. They are simple and they're kind of geared towards what you're needing and how to help you and strengthen your body. So the quick little exercises, there's even memory exercises in there because memory is really important to kind of keep that active and going to help you with your falls. But it is an app and people can use it whenever and wherever they would like.
Is that what, when someone signs up and downloads this, is this the first thing they'll be seeing?
Yes, so this is the first screen that they'll be seeing. You go ahead onto that app. You can download it onto your phone. You will get a registration page, so you go ahead and register. But this is free to actually get the program as long as you're an Oshkosh resident.
Okay,
So,
and what's the next one that we have?
So this is some examples. So once you get into the program and it starts doing little exercises each day, this is one of them that could be. This is kind of a memory on the right side with the different pictures. That's a memory little exercise that they would have. Okay. And then on the left is just a simple little stretch and balance exercise that they would do to really get your strength and your core together. They have it modified for sitting and standing, so it really does work for whatever you would need and individualize to yourself.
Okay. Let's take a look at the next one and see what we have here. Is this still part of Nimble? Or?
Yes, this is Nimble. So it is a clinically proven to have outcomes. People really enjoy it. It's supposed to be evidence-based and really help your emotional health. And really, there's a lot of science behind this app, too.
Sure. When we talk about something being evidence-based, what does that really mean? What are they gathering? They're gathering what? Information and...
If you have an evidence-based program, it means that it has been researched a lot of times through a university. They've researched it, they've tested it, they've run trials on it, they've evaluated it. It's almost always 100% of the time published in a journal of some sort. Like the American
medical journal,
yes,
that type of thing.
A peer journal. So it's not like something that they just whipped up and said, "Oh, this should be fun." Yeah. We know quite a bit. Let's make our own, which we do, but. This has been proven and tested.
Okay. All right. Very good. Okay. I think we have another screen probably about, well, this is that one on Nimble still.
Yes.
Do we have any other screens on Nimble?
No.
Okay. We're done. All right. So I'm excited to try this Nimble app. I just have downloaded it and started getting the registration information in there. But I'm excited to start using it and seeing how it helps me, because I don't always have the best balance. When you start getting arthritis and all these other things, everything that you get seems to factor in with how you can perform other functions in life. And it's interesting how they're all interconnected, and yet it can be very frustrating. Very frustrating to have them all interconnected.
People don't realize that depression is a risk for falls, because you tend to walk with your head down and you're shuffling your feet, and you don't want to shuffle unless you're on the ice. Don't shuffle.
Yeah.
And that's
walk heel toe.
And depression is another screening that when we come out, if that's something we're worried about, we do a depression screening. We do a sit and stand, where you sit and stand and see how long it takes. So we do lots of different screenings when we go in to really meet your needs and really help you and get you to the right program and the right resource.
And that's why we're excited that we're getting an evals from like Strong Bodies, especially movement classes, because they do up your endorphins, Tai Chi and Strong Bodies, and that I am feeling better. I am less anxious. I am less depressed. I'm feeling stronger, so therefore I feel better about myself. We always feel better about ourselves if we improve.
And well, just getting out and being with people,
it improves.
Improves that depression that a lot of people may feel. And let's face it, when we start getting older and friends are dying off or whatever, and
so the social connection.
Yep. So it's everything, again, like I just said, it's all connected.
It is.
Whether we like it being connected or not, it is. And it's a factor that we all have to deal with. And so you mentioned about walking with, like your head down. Now, I will admit, I sometimes walk, I don't have my head way down like this, but I do tend to walk with my head somewhat down, because I'm trying to watch where I'm walking so that I don't step on something that's going to throw my balance off.
You want to walk with your eyes not like this, because you do have to see where you're headed, but you're looking about 6 feet out, not straight down. Straight down, you're going to miss the next step, because you're not looking, you're looking like 6 feet out, because you're scanning to see what am I hitting that I want to avoid.
Yeah. So, okay. Anything else that you want to share with us, Lindsay, about what you do as a public health nurse for the county?
So we'll just come out and a lot of education. We're really just trying to make a healthier community, and we want to keep you in your home. Like, that's our goal, is to understand and connect you to whatever that is, to really keep you in your home and keep you healthy.
Okay. All right. And so that's free for people, and they should just contact the county health department.
Yes.
And I want to mention also, when you talk about coming out to people's homes, I had something happen with me, and now I have my Medicare is It's not the straight Medicare card. It's a Medicare Advantage Plus type thing. And so with the plan that I have, you get $40 every quarter, and it's on a card, like a credit card type thing, but you get $40 every quarter to go to United Healthcare's website and purchase over-the-counter items and what have you. But what happened to me last summer is they reached out to me and they said, we have a program, if you're interested, where I think she was a nurse of some sort, or maybe a nurse practitioner, I can't remember, but they would come out to your home. They didn't necessarily assess for falls and that kind of thing, but she sat and talked with me. I did it because they were offering me $75 on my card to buy some more over-the-counter stuff, so I thought, why not? Free money is free money. But, she came out, she talked to me about medications, she talked to me about any conditions I might have, and that kind of thing. And, had there been anything of concern with her, she would have made suggestions and that kind of thing. And so that's something that they'll do once a year. So, if you are on Medicare and you've got an Advantage plan, no matter what kind it is, I would at least look into that, because that's one more free service, if your plan offers it, that can help you. I got to say, when you get to a certain age, you need all the help you can get. And so if it's being offered free of charge, and in this case they're paying you to do it, take advantage of it. But be careful that you don't get scammed. That's one thing for sure. You got to be careful that you're not getting scammed. So anyway, that's the plug I wanted to put in, because it kind of dovetails with what you do. So, all right. Well, let's move on. Now, Nicole, you have kind of talked a little bit about some of the things that you guys do. What else do you do as far as social connectedness? Anything new coming up in the future, or how did COVID affect what you do?
Sure. So one of the things I think that impacts social isolation is memory issues. So a lot of times people start becoming fearful that if they're concerned that they have a memory issue. One of the wonderful things that we offer at the ADRC is all of our staff know how to do memory screens. So it's really important to get a memory screen when you have a concern, so you can get a baseline. This is where I'm at today. A lot of times, if you're having some memory issues, it could be because of a medication that you're taking. It could be because of a medical condition. It doesn't mean that you have dementia. And so it's really important to get a baseline memory screen. And it's something that we offer for free. You can come in, you can get a screen, you can have an idea of what normal aging versus maybe some memory concerns are. And we can help navigate you if there are some memory concerns, because there are a lot of preventative things that you can do if you are starting to have memory issues. So memory issues isolate people. The wonderful thing in Winnebago County is that we have tons of programs that connect people with memory issues. We have programs called memory cafes that are more social connectedness. We have programs it's called Beaming Inc., so that's horseback riding for people with memory issues. We have the Spark program, so it's art and music programs for people with memory issues. We have something called the Virtual Dementia Tour that we offer, and so it's for anyone in the community that would like to know what it feels like to have memory issues, so that they can have empathy for people with memory issues. And we put you through a virtual simulation of 8 minutes of what it's like, and it's totally free.
And what is that?
It's called the Virtual Dementia Tour.
Virtual Dementia Tour.
So every second Tuesday of the month, we offer it at Parkview Health Center. But we are starting to bring it into the community. So on May 16th, we're going to Winnebago, and we're bringing it to people. And one of the wonderful things is it gives you an idea of what it feels like to have memory issues, so that you understand how to connect with people with memory issues, whether you're a caregiver or a community member, because it allows you to feel like this is what they're going through, and it gives people a lot of empathy.
And I can see where that would be good, well, for anyone really, but people with dementia, even in a grocery store, for example, they can be thinking about one thing, and all of a sudden they're not sure where they are, they're not sure what they're doing. And, you know, let's face it, we're a society that is on the move. We want to get our stuff and get done and move, and very fast-paced. Immediacy is a big thing, and nobody wants to be slowed down by someone who can't figure out, you know, what they're doing. And I just think that that's a horrible thing to think about with people as they age. And I think that that would be a wonderful thing for people to go through and really understand, you know, what these folks are going through. And you said it's 8 minutes long?
It's 8 minutes long,
Okay.
and then afterwards we do a debrief. So we talk to people about how did that make you feel and how could you connect better with people that have memory issues. Because in the end, even if you have memory issues, you want to feel like a valuable person in society.
Sure.
And when we put people in homes and socially isolate them and don't allow them to continue to be valuable, that's where the depression comes in. No matter whether you are able to do all the things that everybody else can do or just a couple of things, you still want to feel like you have value and you're still a person.
Sure.
And I think a lot of times we try to safeguard people with memory issues so that nothing bad happens or they don't get hurt. But then they end up feeling like they don't have anything to give anyone anymore.
And so that leads to more isolation.
And more depression.
And depression, yep. Yeah. The memory cafes, let's talk just for a moment about...
I'm doing one of those next Tuesday.
Oh, you are?
I am.
What are you doing with it?
I am doing laughter yoga.
Laughter yoga. No, what is that?
Yoga that makes you laugh? No. This isn't in the program, but I'll tell you really briefly. It is, they have found all the studies when you laugh, how it increases your endorphins, lessens your stress hormones, yada, yada, yo. They found that even if you fake laugh, it has those same medical benefits.
Oh, wow.
So you work with the breathing part of yoga, and you do these kind of silly things, and everybody ends up laughing.
Where
so
is
it's
that
fun
being
to
held,
do.
Joanne?
This one is, I've done it in Oshkosh last year. This year it's in Tuesdays at Menasha Public Library at, I believe, 1 o'clock.
Menasha next Tuesday.
Yeah, but I do them in Oshkosh as well, and it's just, I don't know, we just laugh.
And we don't laugh enough.
No, I agree.
In this society.
A child laughs 300 times a day. An adult laughs 15.
How do you come up? Who came up with those numbers?
I think you just watch a kid, because kids don't think about laughing; they just laugh.
Sure, it's very
like
natural.
they're running through the playground. They're all laughing. They're not laughing. We laugh only cognitively. Is something you just said funny? Yes, then I'll laugh. You know, like kids just laugh.
Well, and you know what? I have to say this, and it seems like it should be very simplistic and very common sense. But if I tend to do most of my work at home because that's where I work. And I'll have on, I always have the TV on for background noise and that kind of thing. And if I've got a bunch of stuff on, like I like mysteries and crime shows and stuff like that. But if I feel like it's getting a little too heavy, or I've just had it on too long, and I can feel myself kind of getting, not moody, but just, and not really depressed, just, I don't want to hear this anymore, you know, it's just too much. I'll switch to a comedy program, and just laughing brings you out of that mood so quickly. And it just, it uplifts your soul and your heart, and you just laugh and laugh and laugh. Yeah. And it's wonderful. So this is a good thing.
Your stress hormones just went down.
Yeah.
Over time, your blood pressure goes down. It's a great thing.
Yeah. All right. Well, we're down to about 10 minutes, so I want to kind of finish up here with Nicole. What other things do you have for us?
Sure. So one of the big things that I really wanted to talk about was how important it is to volunteer. So whether you're retired and you're looking for something to do to stay connected with your community. And so one of the programs that allows people to volunteer at any age, really, is we have a volunteer driver program. And Joanne talked a little bit about that through AdvoCap. So just to give you a little bit of perspective, in 2023, the volunteer drivers provided almost 1,400 rides to people in Winnebago County. 1,200 of those were for medical reasons. So they are a huge need. and we are looking for more volunteer drivers. 784 rides had to be turned away last year because of no driver. That's 784 older adults who needed to get somewhere, probably a medical ride, that weren't able to get there due to not having a driver. So just one driver can make a difference. And we do reimburse mileage. So you're just volunteering your time, but that connection in the car and that older adult knowing that they have someone to count on is so valuable. And Lindsay and I, when we have been taking people to the grocery store, have been driving them ourselves, you know, and the connection in the car and the conversations that you have with people. So that impacts social isolation as well. But the ability to give back to your community when you have the time is just an invaluable thing.
It is. I have said for probably the last 25 years that if every person volunteered just 1 hour a week or 1 hour every 2 weeks doing something, and let's face it, everybody can find something to do to volunteer. There's no shortage, like you said, of needs where volunteers can make a huge difference. If every person just did 1 hour a week or every 2 weeks, what a difference this entire country would have. You know, it would have such a positive effect on things. So these folks, I want to understand this. This is different from the other program that you talked about, right?
Yeah, the dial ride. Yeah, this is different.
Okay, so people don't pay for rides in this case, right?
Correct.
Okay, so it's free, and you will take them anywhere?
Anywhere, yep.
For within the county, I'm assuming.
No,
or,
so some people might have a ride to Milwaukee because they have a specialty appointment that they need to go to. Sometimes people have rides to Madison, Green Bay.
Okay.
It just depends if we have a volunteer to transport. So some rides are within the county, and some rides can be, you know, all over Wisconsin depending upon what the need is.
Okay.
A lot of times people have a need to go to dialysis.
Okay.
It's a huge need. Specifically, people that live in rural areas, to get to dialysis is a struggle for a lot of people, or cancer treatments when you have to go to chemo every day and you have to get to Green Bay or Appleton. So there is a huge need for medical rides.
Okay, and so do you, because dialysis takes a while, chemo takes a while, do you have to sit there while they're having all this done, or can you go and do something else and then come back when they're done?
I think it depends upon the person,
okay,
and what they'd prefer to do. But you definitely can leave and come back and pick the person up when it works for them. Sometimes people like to stay. But yeah, it's very on a volunteer basis. So you can pick up rides when you want to pick them up. You don't have to go every Tuesday. You can let them know, like, I'm only willing to do 2 days a month or 1 day this month, and it can change. It's really whatever you're able to give.
And then I don't want people to be fearful about doing this because the first thing that comes to my mind, okay, we're talking medical appointments here, even though the rides can go anywhere for any reason. But in terms of medical rides, okay, what if someone's in a wheelchair? I'm not equipped to do that. What if they have trouble getting in and out of an SUV? I'm not strong enough to help them get in. I don't want people to be fearful about this. So can they say to you, okay, I want to volunteer driving folks, but I can't do this, that, and the other?
Absolutely.
Okay.
Yeah, and they can kind of pick up the type of rides that they would like.
Okay.
If you're only willing to do rides, you know, that are within Winnebago County, or if you want to do longer rides, a lot of times we have veterans who enjoy driving and who like to take people to longer appointments and who only want to drive for long periods of time. So it's very much based upon what you're willing to do and what you're able to do. And, you know, one ride a year is better than no rides a year.
Yeah, for sure. And so that's called a volunteer driver program? Is that what it is?
Yes, and it's through AdvoCap.
AdvoCap, okay. All right, so can they get to AdvoCap through the county's website? Or do they need to go to a separate website?
They can go through AdvoCap's website, but a lot of times people will call us and say, I'm interested in volunteering. What opportunities do you have for older adults? And we can shoot you in the right direction. The nice thing about the ADRC is we are the resource center for older adults or people with disabilities. So we basically know all of the resources. So any questions you have, any concerns, any comments, any things that you want to see in the community, you call us and we can help.
Okay. All right. And I think that was the gist of what we were talking about tonight, I think, right? There was nothing else?
I think that's about
it. Okay. One question that I had then, and we've got about 3.5 minutes left. You know, a lot of people have dementia, of course. Do you have any kinds of programming for people who have Parkinson's disease? Because that's a big one. I know 3 people right now who have been diagnosed with Parkinson's. Is there anything that is offered for them?
Yeah, absolutely. A lot of the programs, so dementia is the umbrella, and all of the other types of, so Parkinson's is a type of dementia, Alzheimer's is a type of dementia. So dementia is like the umbrella term for the memory issues, and so there are different types. So a lot of the programs like the memory cafes, people with Parkinson's go to that. There are specialty programs specifically for Parkinson's, but calling us, you know, we can direct you to those. Also, Fox Valley Memory Project, they're a huge part of the community that allows people to get connected to resources for those type of things.
Sure. And just tell us.
Support groups out there. Plus the Oshkosh Senior Center, I know they have classes for people, you know, exercise classes for people with mobility issues. And one of the groups that they go to is Parkinson's, and that might be where the support group is. I'm not sure, but they're there.
All right. And let's just talk real briefly about the memory cafes, because they're so important. Go ahead.
Yeah.
Tell us about them.
So there's all different ones, and like Joanne said, you know, she's going to one. So they try to do a different theme every month. So the YMCA has them. We have a traveling one. Yesterday they went to Planet Perk, the cat cafe, and they also did essential oils there. They have them at the Nina Library, the Menasha Senior Center, and then all throughout Appleton, of course, in the Fox Valley. But it's really geared towards a person with memory issues feeling inclusive and their caregiver also being able to connect with people. So you can feel safe taking your person out in the community with memory issues, and you can feel included, and you don't have to worry that people are looking at you or they're going to be uncomfortable. It's just a really safe space to build your social network. But also doing fun things. You know, they do music. They've done potting plants before. They have memory cafes at Beaming Inc. So they have memory cafes that involve the horses. It's just such a valuable thing, and to know that just because you have a health issue or a memory issue doesn't mean that you can't be involved in so many positive things in the community.
Okay. All right. Any parting thoughts from anyone? I think that Nicole just summed it up best, probably. You know, I have found this last hour just fascinating because, you know, I knew about some of these things because you've been on before, but I didn't know about some of this other stuff. And, you know, so for people to say there's nothing to do in Oshkosh, there are tons of things to do in Oshkosh. And just because you may be elderly and you might not have the best balance in the world, or you've got some other issues, please don't let any of that stop you from getting involved and being part of the community, because community is what keeps us all together, and that's important at any age. So get involved and make yourself, you know, available to participate in these things. I guess that would be my parting thought. So, and again, I just wanted to give that address, that website address one more time. It's co.winnebago.wi.us/health. And that's it. Ladies, thanks so much for being here. It's been a lot of fun and very, very educational. So thank you. That's going to do it for us. We will see you next time. Thanks to the crew, thanks to my guests, and thanks to you. Take good care until the next time we meet, and keep your eye on us. We've got our eye on Oshkosh.